My friends, this is Dr. B, the best doctor in medicine. Today, I want to talk to you about your diabetes and how diabetes destroys slowly but surely your kidneys. Guys, diabetes is a disaster. It is just like high blood pressure, right? Hypertension. These are the silent killers. They are inside you and they kill you slowly but surely. So you have to very, very, very carefully listen to this video. Listen, the kidneys, these two organs that are in your retroperitoneal cavity space, retroperitoneal space, in the back of your tummy, on each side of your spine, you have one kidney on the right side, one on the left side, right? Inside these kidneys, each kidney has about 1 million tiny, tiny microscopic filtering glomeruli, right? Plural of glomerulus. They are tiny, tiny microscopic physiologic, anatomical, functional elements of the kidney to filter your blood. 1 million in each kidney, about, right? It depends how big is the kidney, how the taller the individual, the bigger the kidney. So bigger kidneys in taller people have obviously more glomeruli than shorter people with smaller kidneys, right? But an average adult has about 1 million glomeruli, tiny filtering glomeruli in each kidney. When your diabetes is not under control, and it doesn't matter whether it's a little bit under control or a very much amount not under control, right? So when your diabetes is not tightly controlled, the excess sugar causes molecular damages to these tiny, tiny little filtering glomeruli. Glomeruli is the plural of glomerulus. So these 1 million on the right side, 1 million on the left kidney that you have, slowly over time become damaged and develop fibrosis, stiffening, hardening, developing fiber over time because of the excess sugar in your blood. The molecular biology of how excess sugar in your blood, even a little bit of excess sugar in your blood, causes damage, sclerosis of your glomeruli. It's pretty complex and it's not the point of this topic, right? The point is to make it easy for you to understand so that you can grab the bull by the horn and take care of your own health care, right? So if your sugar is not very tightly under control like Dr. B's sugar, slowly over time, this excess sugar is going to damage these little filtering elements in your kidney, and slowly over time, day after day, week after week, month after month, years after years, eventually it's going to destroy your kidneys. So your glomerular filtration rate, the amount of blood that your kidneys can filter, over time will decrease, and eventually you're going to be diagnosed with kidney failure, which initially will be called mild, then moderate, then severe, right? So excess sugar, and it doesn't matter, please, don't listen to these ignorant doctors, family doctors, internists, and blah, 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 who tell you that it's okay if your sugar is not absolutely normal, if your hemoglobin A1C is not less than 5.7, as long as it doesn't go above 7, you're okay. What? No, it's not okay, because even a tiny bit of elevation of sugar in your blood over time will cause damage. Obviously, the damage will be slower than if your sugar is really high and your diabetes is absolutely not under control, but the damage will still happen. It's like saying, well, you don't have severe high blood pressure, your high blood pressure is mild, therefore it's okay. No, it's not. Because high blood pressure, even if it's mild, over time, it will eventually damage your eyes, your brain, your heart, your kidney, your liver, everything, right? So we don't treat a disease only when it becomes severe. We treat a disease and we get rid of the disease starting at the mild stage. And that's valid for every disease, whether it's high blood pressure or diabetes or anything else. It's like saying my cholesterol is not very high, it's mild to moderately high, therefore my doctor said it's okay. No, it's not, because over time there is a cumulative effect, and we have definitely proof, evidence, right? Observational studies that have proven that even people who are diabetic and who have mild elevation of hemoglobin A1C in the range that we call borderline diabetes or pre-diabetes, they can definitely over many years damage their kidneys. So all these people who say, I have pre-diabetes, my doctor said it's okay, he's not going to do anything until I have diabetes. This is absolutely, absolutely insane. Do not listen to such a doctor. Change your doctor, go see somebody else. Because even if you have pre-diabetes, means your hemoglobin A1C is between 5.7 to 6.4, you are causing damage to your body, slowly but surely. My hemoglobin A1C is at 1.5. 1.5. Normal is less than 5.7. If your hemoglobin A1C is less than 5.7, you're okay. If you are between 5.7 and 6.4, you have prediabetes. You should be scared. And if you have more than 6.4% of hemoglobin A1C, then you have diabetes. That's a disaster. But saying that I have mild high blood pressure, or I have mild diabetes, or I have pre-diabetes, therefore I'm okay, I'm not going to treat it, it is absolute BS. You have to address it. I'm not saying you have to take medication, but at least you have to start exercising, zipping your mouth, going on the keto diet, blah, 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 blah. You get my point, right? For the mild conditions like mild high blood pressure, mild elevation of high cholesterol, borderline diabetes, or mild diabetes, you can definitely beat the disease by changing your lifestyle. But that you need to have the willpower that Dr. B has, and you need to watch my videos. I tell you exactly how to do all that, right? So listen to me. Even if you have mild elevation of your hemoglobin A1C, means above 6.4%, right? 6.4%. But if it's still mild, means doesn't go beyond 7 or 8, you are still in trouble, right? And if you have borderline, if you are pre-diabetic, right? Pre-diabetic means your hemoglobin A1C is between 5.7 and 6.4. Over time, you will cause damage to your kidneys. So it means you're going to kill, destroy, cause sclerosis, fibrosis of these tiny glomeruli, plural of glomerulus, which are the tiny filtering element that allow your kidney to filter the blood and eliminate all these toxins and blah, 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 right? The name of this disease is called glomerulosclerosis. Glomerulo, because it's the glomerulus, the glomeruli of each kidney, 1 million on each side, this tiny filtering element. glomerulosclerosis. In medicine, the term sclerosis means scar. You are scarring. You cause fibrosis, scarring of those tiny little glomeruli, and eventually, even though you have 1 million in this one, 1 million on this side, every day you are killing a few. It adds up. So eventually, after a few years, you're going to develop kidney failure, mild first, then moderate, then severe. Then you need to be on hemodialysis and go on a list for kidney transfer. It's a disaster. Means all your retirement dreams, everything is gone away, right? And then you have to take these immunosuppressants so that you don't reject the kidney. Many times with these immunosuppressants, people still reject the kidney, they get another one, then they get infections, blah, 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 because their immune system is being killed by these immunosuppressants. They get cancers because their immune system is being killed by these immunosuppressors. It's a disaster. I mean, how can people do this to themselves? It is ignorance from people and their doctors. So don't be among them. You need to be your own healthcare advocate. You need to change your healthcare team if your healthcare team doesn't give you what you deserve, if they don't care about you. And you can see that. I changed my dentist twice before I found this one that I have now, who is excellent. You can see very quickly the dentist doesn't care about you. He's just doing the job quickly. He doesn't care about doing my teeth in a nice professional way. He just want to do it quickly to run in the other room so that he can make more money. I changed dentist twice. And in medicine is the same. If your team, your care team doesn't care about you, and you can feel it. I mean, I know you know it. Then you are allowed to, you have the right, the obligation to change. Just call your insurance, find another good doctor by reference, blah, 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 and change your healthcare team. But don't stay with the same doctor who tells you, oh, it's okay, you have borderline diabetes, that's okay. No, it's not okay, right? Even if you don't give him medicine to your patient, you need to help your patient get rid of that pre-diabetes, right? Because you still have high glucose, high hemoglobin A1C, right? And it's a sign that you are destroying slowly, even though at a slower pace, but surely you are destroying your kidney, not just your kidneys, your eyes, your brain, your heart, your everything. Diabetes, even pre-diabetes, although at a slower rate, it destroys everything in your body. I don't want to go into the biomolecular mechanism. That's not the point. But it causes damage, right? In different ways, in different organs, blah, blah, blah. It's a disaster. So regardless of whether you have mild high blood pressure or moderate or severe, you need to address it. Whether it's with medication or lifestyle changing, you need to address it. You cannot just leave alone your mild high blood pressure and take care of it only when it becomes moderate or severe, right? It is the same for diabetes, whether you have pre-diabetes or mild overt diabetes, you need to address it, whether it's with medication or lifestyle changes. You have to not ignore it, because it will kill your kidney, your kidneys, and of course your brain, blah, 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 blah. Now, remember, if you are either diabetic or pre-diabetic, make sure that you do like Dr. B. I'm not advertising any brand, but you have to buy online for cheap, $10, $12, $14, these urinary dipsticks. I don't have no diabetes, no high blood pressure, nothing. I just buy them because every week I check my urine for blood, for protein, for everything, right? I just do it because I care about myself, right? The same way you should. Every week I do this. Now, if I had diabetes, I would do this every day to look for microalbuminuria, right? In addition to looking for blood and leukocyte and nitrates and blah, 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 right? This dipsticks, right? These urinary dipsticks. You pee in a plastic cup every morning, and then you put this in the plastic cups, and it tells you if you have blood, if you have protein, if you have albumin, if you have this, if you have that, right? Or if your urine is nice and healthy, right? So you have to do that if you have diabetes every freaking day, to look for microalbuminuria. I don't have diabetes, but I check my health every day, every week with a dipstick in my urine. I pee in a cup. Every day in the morning, I pee in a cup. I look at it, the urine, to make sure it's clear and everything. Then I discard it, right? But once a week, I pee in the cup. And I also do the dipstick in my urine. If you have diabetes, you need to do this every day. If you have high blood pressure, you need to do this at least once every week, high blood pressure. Diabetes, you do this every day. I mean, how can you not do that? I don't get it. It's cheap. It takes you 30 seconds, right? And you do it. You get your peace of mind that you don't have no microalbuminuria. If you have microalbuminuria, you go to your doctor. Don't wait for 3 months or 4 months or 6 months until you see your doctor so that your doctor can do this test at the clinic. You have to not give your health care 100% in the hands of your doctor, right? You need to become your own healthcare advocate, right? You need to become your own healthcare boss. The good old days when people used to entrust their doctor 100% with their healthcare are gone. Doctors are now businessmen or businesswomen. They are busy running a business, making a lot of money, seeing 30, 40, 50 patients, 35 patients, 25 patients in a day. In and out, from one exam room to the other. 5 minutes only they spend with a doctor, with a patient, because they want to make money, a lot of money to pay for their Mercedes-Benz, their 5 bedroom, 4 bathroom villa with swimming pool, pay for their vacation in the Bahamas, and pay for the expensive lifestyle that they have. They have to pay the rent that is going up for their clinic, the receptionist, the nurses, blah, blah. So you get my point. The doctors nowadays, whether it's hospital or clinic, it doesn't matter. They are all super busy. They are pushed with a lot of patients. They want to see a lot of patients so that they can make the more money possible. So they spend 5 minutes in the exam room. Statistics of the American Medical Association, right, official, whereas the patients spend 45 minutes in the waiting room, waiting to be taken inside the exam room. Official statistic of the Medical Association, 45 minutes is the average a patient waits in the waiting room. It's crazy. But that's how it is. So you have to not entrust everything to your doctor, and doctor is going to just quickly... you see, he doesn't care about you because he cares about you as long as you bring money to the business, right? If you didn't have insurance or not pay cash, he wouldn't see you. He would say, what? You don't want to pay cash? You don't have insurance? I'm not going to see you, right? So he doesn't care about you because you're not his family, right? If you were a family member, he would see you for free, right? But you're not a family member. He wants to make money out of you, right? It's like a dentist. My dentist wants to make money out of me, right? So it's the same. So you have to not think that this doctor cares about you like you're a family member. He cares only for the 5 minutes that he can see you and then bill your insurance and make money. So during these 5 minutes, you don't have the time much to ask questions, blah, blah, blah. But you should. You should. I posted a video about that. And if you think you don't get what you deserve, you just change. There's millions of doctors everywhere. You can find another one. There's no reason to stick with the same one. But at the same time, you need to be educated, educate yourself about your disease, watch my videos. I explain to you the easy way, the simple way, what you need to do, because never forget that for diabetes, the very first sign that you have kidney damage, and your doctor not going to tell you that, the very, very first sign that your diabetes is causing kidney damage is what we call microalbuminuria. Microalbuminuria. Albumin is a protein in your blood. And normally you have less than 30 milligram per day in your urine. It doesn't pass from your blood into your urine. But if your kidneys are damaged because of diabetes, right, because of this glomerulosclerosis, then obviously more albumin is going to pass into your urine. And these dipsticks are going to detect that excessive albumin that is 30 milligram or more per day. Then, of course, you need to, if that is positive, you don't wait for your doctor to be seeing you in 6 months. You call him immediately, you make an appointment, and then they're going to do an official dosage at the lab, measurement at the lab of your 24-hour urine. They're going to make you pee in a big bucket, take it home, and you pee the whole day, 24 hours, you pee in that big bucket, you take it to the lab, and they will measure the entire albumin in that urine during 24 hours. But this is an excellent way to detect that early kidney damage that you are causing because of your prediabetes or your mild diabetes that none of your doctors want to address, because it's like, oh, it's okay, just go home. This will help you detect this early damage called microalbuminuria. If you have damage of the kidney, initially the very first sign is you are peeing albumin. Albumin is the number one major protein in your blood. And if your kidneys are damaged, it's going to filter it and pass into your urine more than the tiny bit of normal, which is less than 30 milligrams per day. Do you understand? If you don't understand, please rewind this video, go back, slow it down, and listen carefully to what I'm doing. Go online and order one of these. Make sure you have one all the time, and check your own urine every day if you have diabetes or prediabetes. It takes you 10 seconds to do this. I do this once a week. Guys, Dr. B is a medical doctor. I took the Hippocratic oath to put your interest above mine. I love you regardless of your gender, ethnicity, race, blah, 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 blah. I will never, ever, ever tell you anything that is my opinion. I will always tell you everything that is based on the medical, proven, scientific knowledge. Regardless of your gender, whether you're a man, a female, or anything in between, race, religion, ethnicity, any cazzo, I don't give a cazzo. I love you as long as you're a human being. I give you a big hug, and God willing, we talk to each other in the next video. Bye-bye.